Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited about my show today. My guest today is Dr. Greg Eckel. Dr. Eckel is a brain regeneration specialist. We discuss how a traumatic event in his life led him to discover new strategies in this new field. His wife Soraya passed of Creutzfeldt-Jakob disease, a condition with no known cure. As she was the love of his life, being a good husband and doctor, he started to research to swing for the fence. While unfortunately not finding a remedy for Soraya, he uncovered Soraya's gifts. The deep dive uncovered the development of a brain regenerative program, the development of a nasal spray specific to calm neuroinflammation in the brain, procedures such as intranasal stem cell delivery to bypass the blood-brain barrier, mind-body techniques to reverse anxiety and post-traumatic stress disorder. The list goes on, and so does the impact of Soraya's all too short life on this planet. In this show, we discuss PTSD, neurodegenerative disease, and he discusses how he became an expert in brain regeneration. I hope you enjoy the show. Hello everyone, super excited to be here with my friend, Dr. Greg Eckel. Greg, how's it going, man?
Oh, it is going really well.
We were just talking a second ago about like all the travel and all the things that we do and how, this was due, dude. Like how long have we known each other and we haven't talked?
I know, seeing each other at conferences and through the years here, we're really going to get into it today.
Yeah, totally. Because, we met through Dr. Alan Christensen, and it's just so cool how everyone is connected, everyone in this space, we have like the same trajectory and we want to help maybe not the same people, but we have the same goal. Before we start, I want you to tell your story. And I know that we talk about how you come to the medicine or how you started, but you've had a couple of hero journeys. This past one was pretty crazy. Can you tell us a little bit about it?
Well, sure. This last one has been definitely life transforming. I lost my wife to a very rare neurodegenerative condition called Creutzfeldt-Jakob disease, which is mad cow syndrome in people. About a 1 in a million chance of that. No known treatments and actually very few answers on how it even gets transmitted. And I mean, I was in clinical practice. She was in my practice as well. Soraya was her name. She was in the practice, certified nurse midwife, nurse practitioner, top of her game, Oregon Health Sciences University trained. And, about 5 years into her practice at Nature Cures, where we're at here in Portland, she started developing some memory issues. And, we went down all kinds of paths of, was it a hormone imbalance? Was it mold toxicity? The things for rapid onset decline. Was it PTSD that triggered memory loss? Like what was going on? And I started taking her to all kinds of specialists, and I was not satisfied with the answers they were giving me. So, as loving husband and physician, I really just launched off on the journey of, well, I'm going to swing for the fence and, maybe we can figure out what's going on. And clearly, early on in the process, a lot of docs were saying, well, this is just a psychotic break. And CJD, Creutzfeldt-Jakob disease, it is a rapidly progressing dementia. At the beginning, it was kind of subtle. We were staying late at clinic, first time ever, and she's, being meticulous in her charting and thinking like, hey, honey, what's going on? Like for 5 years, we've never been here this late. Like what is going on? And so, it was kind of this subtle movement. And then it became really clear, no, there's something seriously wrong here. And, we had to like extricate her out of the clinic. She didn't want to stop practice and basically went on a vacation with my kids in July 2017 and told my staff, like, just push her, schedule back 3 or 4 months until we figure out what's going on here. And she never made it back. She was gone within 2 months, just total dementia, couldn't communicate. It's a, just dismal prognosis. And, that one was on the on the differential, but unfortunately, there's no lab test or there's no imaging. Really, the only way to get a definitive diagnosis of Creutzfeldt-Jakob is a brain biopsy, and that was what was offered to me at Case Western. I contacted them. They're the Prionic Research Surveillance Center in North America. Learned this along the way out of Ohio. And, talking with the docs there, they had 25 people enrolled in their study, which was just observational. So, at this point in time, I would consider myself an expert in Creutzfeldt-Jakob disease. I lived with that condition for 2 years. I mean, I guess I'm thankful that it didn't go on for a long time. Folks with dementia, Alzheimer's, I had an uncle, he had that for 10 years. And, that's brutal, having your loved one just basically gone for that long. This was, very intense. It made me, go into the literature. And so what we'll talk about, I think, this morning is kind of what I uncovered is what I'm calling Soraya's gifts. It's, as part of my practice for 16 years, neurology was definitely up there as a specialty. However, this one, going through this with Soraya, really made me dig deep and get in on the research. And, I'm putting out a book for Parkinson's disease, which isn't Creutzfeldt-Jakob, but we can talk about kind of some of those interrelations in neurologic conditions and why I think there haven't been any big breakthroughs in care for Parkinson's, Alzheimer's, dementia, possibly even MS. Anxiety is actually related to some of these conditions, and I can talk about how that gets put in there too. But the process on a personal level, it broke me up open, and it really lifted the veil on what we're doing
and how we're doing it,
yeah, and how we communicate, and what we're up to.
Can you talk a little bit, or can you touch on, you mentioned prions, because if there's something that scares me, is prions.
Yeah, they get talked about in the literature, these infectious agents. And, I haven't been able to trace that back to where they get this category of infectious agent.
It's so funny that it is an infection. So there's viruses and there's bacteria, and, bacteria, they're easy to conceptualize,
right,
the little
right.
organisms with multiple organelles, and then viruses get a little bit weird, because they're just like code. And then prions, they're just like an amino acid. There's like a protein.
Yeah, it's misfolded protein, and without any genetic material in them. So they're very odd. Honestly, Guillermo, I think that they are an archaic protein structure on the planet. I think these things have been around from the beginning. But, they got discovered in 1987. Stanley Prusiner down in San Francisco got a Nobel Prize for this. He was ridiculed for about 2 decades in his profession. And he's really about the only person, he's a bench chemist, that really got in the laboratory and said, these are not behaving like a virus or a bacteria. They're really misfolded proteins. But what we don't know is what activates them. And, I got the second edition of the prion disease textbook. And what you discover in there is all of these other protein misfolding disorders, the Dow proteins or beta amyloid, alpha-synuclein. All of these other neurologic conditions have proteins that are not confirming or conforming correctly. And, the technical term is they muck up the central nervous system. And that, that's very interesting. They are everywhere. So, when I start talking to people about these, people get freaked out. And there are people that, have some quote unquote remedies to deactivate these prions. And, I can just imagine they're out in public, like in the restaurant, spraying down the table and their silverware. And
yeah, because speaking of folding proteins, for anyone that doesn't know what that means, it's like you get an egg, okay, and the egg white is translucent and clear, and then you add a little bit of heat, and those proteins begin to fold. They begin to change in structure, and now you have egg, like a cooked egg. And up until recently, there's a group, I don't know out of where, that were able to unfold proteins in egg. So they had a cooked egg and they uncooked it. And this is, pretty new, earlier this year. But it's very, very, very hard. And what prions do is that they touch another protein in the brain, or they activate this folding, and it's like a domino effect where they start folding and folding and folding, and everything begins to fold, and it begins to, like you said, muck up the system. But there are prions everywhere. They just don't get activated a lot.
No, and this is, these are similar diseases. This is chronic wasting syndrome in deer. It's Kudru in Papua New Guinea, where they used to have a tradition of the women, the grandmothers, and the girls eating the brains of their, loved dead ones. They don't do that anymore. There's it's scrappy in goats. So these are also found in other animals, and then mad cow syndrome in cattle. But you look at it, if it was truly just from ingesting the prions, we would have had a major outbreak in Europe in the 80s. There was about 3 million pounds of tainted beef released throughout Europe in the 80s, if you remember back then, or you can definitely look it up in the history books. But it did not result. It resulted in a mini spike, but not a major outbreak. Like, wow, this is an infectious disease. So there may be a genetic platform that makes some people more susceptible to it. One theory that I've got on it is perhaps these proteins are in our inherent ability of the body's ability to heal itself. Maybe they're set up as a protective mechanism. So, it really led me down a path on genetic platform, but then also trauma and ancestral trauma. When you get in on those curses of 7 generations, well, you can actually see how those come to be, where our great grandmothers had a trauma that activated a genetic, turned on some genes that then started expressing in a certain fashion that then comes to today. So it's, it really made my job and our job as physicians much harder. It's like I am just taking these deep dives with patients now around this. And, you discover people don't really know their ancestral lineage beyond 1 or 2 generations, really, most commonly. And we have, some question mark on some of the genetic testing out there now. So, but it is something to bring into the discussion, because if we just look at a biochemical, it's beyond just biochemistry, right?
Yeah, it's so scary. Okay, and
Yeah.
I'm gonna make a couple of points on how scary this stuff is. And it's like analysis paralysis, because, like you said, we've never had a huge outbreak. And if it was this contagious, or if it was this infectious or virulent, we wouldn't be here. But, like, for example, one of the reasons natural desiccated thyroid is made out of pigs' thyroid is because the thyroid is too close to the cow's head. So it's a precaution to prevent this type of disease.
Right.
Yeah. How many people? I grew up in Mexico. I lived in Mexico for 14 years of my life. And every Sunday, we had the classically made traditional barbacoa, which you take a cow's head and you wrap it in bags, in like mesh, bags that you carry grain with, and then you bury it underneath, rocks. You bury it overnight, and then you pull it out the next morning, and then you eat it. So I've had my share of brains, in my 37 years of
That
life.
sounds so delicious.
Oh, it is so delicious. And okay, so there is only, in the United States, there is only one place in Brownsville, Texas, that actually makes the barbacoa in that way, because people are freaked out. We're so freaked out about this, going to another country and then partaking in traditional foods or traditional ceremonies. And there's disclaimers about the possibility of contracting these prionic diseases. And it doesn't happen. I'm telling you, I am freaked out about prions.
When you start getting into it, it can get really scary. And I'm telling you, I've lived with the condition. Soraya had that. And so, basically when I was talking to some infectious agent experts, they're like looking at us like, no, I went through that mega freak out, like, oh my God, it's here. Like, I'm changing her. Like, this is for real. And then, you get to a point, and that was, one of the aspects that I was going to talk about just personally. You get to this point of, nah, I'm going to just surrender to life. I'm going to trust that this all works out in the end. Now, it was a tragic loss, but we can't walk around in fear. Like we are amazing creative beings, and our minds are very powerful. So, you really got to reel that in and, ground yourself of, no, I'm going to walk through this and it will be fine. Or you'll contract it and you'll die, but you have to kind of just release that, that fear component, because it can drive you batty. Because, what I just came to that conclusion of, like, wait a minute, these are not new. These are archaic protein structures that have been on the planet from the beginning. We just discovered them, right?
We, quote unquote, big bunny ears. We just discovered them because,
I know, exactly,
because we are the end all be all of everything, and if we don't see it under a microscope, they don't exist.
Exactly, right. And so on all of those, so it really does open you up to, okay, well, we don't really know what's going on, and we are trying our best, especially when you get in on the research and it's infectious prions, infectious, it's like, well, what? These are not, it's not as a virus or a bacteria. It's not virulent like that. And I think, we have them. It's part of our microbiome. It's on our surface of our skin. It's on these surfaces. And the component, I think, where you're going with that is that you can't deactivate them or, quote unquote, kill them, because there's nothing in there to
target.
Right. And so that's the part. Now, what I uncovered as part of this Soraya's gifts is there are some simple solutions. There's found over $2 million of research of a company called Briotech with the NIH on showing this anhydrous chloride, HOCl, very simple solution, can deactivate prionic activity in proteins. So this is getting used on surgical equipment. Not all surgery centers use this, though. So there have been some infections from surgical equipment not being sterilized.
Yeah, I don't think we've talked about how persistent they are, because you can't, so viruses, and bacteria, you can cook them, you can put them in the autoclave, and that's it, they get destroyed. Not so much with prions.
No, they are kind of in the indestructible category. And that's, I think, what freaks people out the most.
Yeah.
And is around like, well, we can't just dip them in acid or heat them up. Now, you can really, go to a very hyper acidic or hyper concentrated solutions. Now, you can't really use that on the human body. So there are these concerns, and, I've developed nasal spray that I use now with my Parkinson's patients, and they notice, hey, so I use a nasal spray because I want to get these things into the brain. So we're using the olfactory nerve through the cribriform process, bypassing the blood-brain barrier. And they notice their speech improves for a few hours after using my nasal spray. So, again, so this is, and I codified this in my book for Parkinson's called Shake It Off, an integrative approach to Parkinson's solutions. And I chose Parkinson's because of its relation here in this misfolded protein category. So I'm not saying that Parkinson's is a prionic condition. However, I would like to test my Parkinson's patients for prions. That's currently not really in general practice. We're looking at bringing in some testing models to make that a reality, though, in clinic, because, we don't have any known cures for these neurologic conditions.
And the treatments that we have are pretty fucking shitty. It's just, let's give some levodopa, carbodopa, low dose, and then increase it until it doesn't work anymore. And once it doesn't work anymore, sorry,
Yeah, end of line, and you're, debilitated. So it's not a pretty picture. And my patients, I just wanted to provide some options, and lo and behold, we found some options for folks.
Can you explain the disease process of Parkinson's? Well, a lot of the people that listen to my show, just like I'm trying to reset the system, because I have been listening to podcasts since like 2009, 2008, and like we have learned so much that now we're like talking at this really high level, and we left a lot of people behind. So this is like a reintroduction to all these health concepts. So how would you explain Parkinson's to a 35-year-old that CrossFits, and has no interest in medicine?
So the telltale signs of what it looks like. So it starts with a noticeable sign, starts with a tremor, like at rest. So not when you're picking up your cup of coffee or holding a book, but really at rest, you have a tremor, usually on just one side of the body. And it's really subtle. The beginning signs of that, the person only notices it themselves. You can't actually see the tremor. They'll feel a kind of a vibration in their body, and then that starts to worsen and get noticeable at rest, and that can be really embarrassing for folks. And that means that's at the brain level, there's an issue happening. And that's alpha-synuclein is a protein structure, and there's some tau proteins that are implicated in that. So it starts with that, and then it can progress. It's called a motor disorder, movement disorder, where you'll see these folks with a stutter step. They'll start to just stutter step, or they feel frozen. And they can't get their bodies moving. And then also there's a telltale sign of a pill rolling in the fingers. So that goes with that tremor. And maybe a little bit of a hunchback that also happens with that. There's a weakness that occurs with it. And then another component, which a lot of people don't realize, is there's a speech aspect of it where in the person's brain, they're about 2 or 3 sentences in front of where their lips are. So there's a whole slowing down, not that of mentition or their thinking process, but just how their body responds and works. So people can live for decades. We've got Michael J. Fox out there, Alan Alda. There's some celebrities that we know out there that have been living with it here locally. Brian Grant Foundation, he's one of my favorite Blazers basketball player, had it, with an early diagnosis, actually I believe he was 36 when he got diagnosed with Parkinson's. So this isn't just an old person condition, and we're seeing this on the rise. And I can talk about that for a bit. But on the Parkinson's picture, some of the early things, it can be up to 2 decades earlier. Constipation, is oftentimes one of those earlier signs. Now, not everybody with constipation is going to develop Parkinson's, but there's a gut-brain connection, right? We talk about the gut as the second brain, and all of our neurotransmitters are made and manufactured in the gut for the brain. So there's a connection there on the vagus nerve. Really, we're tying all of that together, which is a really exciting time to be alive and practice with all of this new research coming out. And, so naturopathic, right? Treat the gut for health, go figure. But it is, that's one is the constipation. Another one is loss of sense of smell. So on that olfactory nerve, that cranial nerve 1 for your sense of smell, 1, that could be just a simple zinc deficiency. But 2, we really want to investigate that. And then one of the earliest symptoms that is just totally fascinated. This is what put Alan Alda, he was the star of MASH, or one of them. He read in the New York Times, a science writer there was talking about recent research looking at people that are acting out their dreams. And so lo and behold, that weekend he was like hitting his wife with his pillow, and in his dreams, it was like a sack of potatoes, and he was like warding off some animal or something like that. But she said, "Hey, you were hitting me with your pillow." And he said, and then that day in the paper, he read it. He's like, "I need to go get checked out." And he got diagnosed with Parkinson's.
That is fascinating. So it's, it's a neurotransmitter disease. There's a part in the brain that starts getting clogged up, that it stops producing these neurotransmitters. And then the connection, to the limbs or to your arms and to your legs, it's not getting a good connection, a good signal. So the signal is gone, and then your body doesn't know how to do it. Now it's just your ions and your sodium and your calcium and your magnesium. They start in and out of the cells, and then they're not controlled, and then now you have this tremor.
Right. Yeah. And it's really, I think, one of the components of it's the end stage that we're really looking at now, which is the dopaminergic or dopamine production and receptors in the brain. Everybody got focused in on that end. And I think it's so far progressed at that point. And why we haven't seen any breakthroughs is that's like end stage at that point. And really, I want to move the discussion upstream, if we can, at looking at, okay, well, what do we do? What can we do to help prevent, slow, or halt, reverse this whole disease progression in all of these neurodegenerative conditions, and Parkinson's in particular? On my website, naturecuresclinic.com, I've got a guide on 4 signs for cognitive decline that you can download and look at that, because that sometimes, on memory loss, I know that's a big concern for folks. So that can sometimes be some early symptoms as well.
It's like the Amazon burning right now, and then investing all our money on better ways to bring water and quench the fires, where that's not the root cause. That is not the root cause. We need to figure out what are we doing about deforestation and how to prevent this fires, not efficient ways of putting them out.
Yeah. So one of the reasons why I jumped from the CJD with what Soraya had, when I was in the research, these things get grouped together. And so I came across so much research for Parkinson's, dementia, Alzheimer's, and looking at there are environmental causes to, we store toxins in our fat. Where do we have a lot of fat? In our brains. We're exposed to 80,000 chemicals in the United States a week. And only about a quarter of those have been tested for health outcomes for us. So, the great experiment is happening. And I think that's where we're seeing a rise in these neurodegenerative states. The average American over 65, it's a 50% chance of developing dementia. Half of the population is going to have some memory loss dementia. That's not normal. That's super common, though. So, in our integrative functional medicine approaches, naturopathically, we're talking, let's look at our diet. Let's look at our exercise, not sexy topics, right? But very important. And then we look at detoxing the body of how do we maintain our health span, our longevity, our brain power to age well.
Does it freak you out that that we have all these crash diets and all this, and you have people that are liberating a lot of these toxins without being able to detoxify them?
Oh, yeah. I mean, it is, it's very interesting, let's say, to see what occurs for folks. But it is, yeah, if you don't have those pathways open, you wonder why, folks will, do that, they'll lose the fat and then boom, they balloon back up because they didn't do anything to get those toxins out and their pathways were closed. So there's no way to detox. And so the body in its inherent wisdom wants to protect us. And so that's, it can be so frustrating for the patients and the general population and thinking like, well, gosh, it's a willpower thing. It's like, no, it's just a level of toxicity. If you're not doing anything to take care of that, to open those pathways, you're not going to get better. You're not going to be able to maintain and sustain that healthy, quote unquote, healthy lifestyle. It's got to be sustainable. That word just keeps coming up as we're talking here, Guillermo, around just sustainability. Like it just has to be built into our day to day rather than an intervention. We just need to build it into our day to day. Here's a very big tangent, but I will bring it in. One of my heroes is Professor Seralani out of France, and he was doing the main work on Roundup and the toxicity of Roundup. And I saw his first lecture in the United States, and he basically arrived at making a cookbook to using herbs and spices, botanicals to detox the body on a day-to-day basis. Now, this is the guy that Monsanto came after. His lab showed Roundup was 100 times more toxic than just glyphosate, the active ingredient listed on the label there for causing cancer. Now, there is an interesting correlation. The glyphosate is shown to kill off certain species of gut biome in our guts and possibly is related to the rise of these neurologic conditions as well. So that's where I was tying that together. But if you're not familiar with Professor Seralani, please look him up. He is a hero. Everybody should know that guy's name. He basically has said Monsanto has committed a crime against humanity. And I'm with him. I mean, I think it's, that is a known cancer-causing agent, possibly implicated in a lot of other conditions as well. And it's sold in the grocery store here in Oregon. It's just, I can't believe it,
Of all places, Oregon.
I know.
So we have this umbrella of all of this, degenerative diseases, and you are a brain regenerative specialist. Where do we start? Do we stop eating wild-caught fish and wild-caught animals? We talk a lot about this in epigenetics and genetics, that the code is there, but if it's not expressing, it doesn't matter. So,
right.
So it's the same thing, I imagine, with these neurologic degenerative diseases. That you might have a couple of prions floating around in your body, and as long as you are not folding them or activating them, they're okay. Where do we start with this? And then in a preventative way. And then let's say your loved one is diagnosed with Parkinson's. What are some steps that we can take to maybe halt the disease or slow it down?
Great question. So at the very least, looking at, I love the Environmental Working Group's Dirty Dozen list. Reduce your toxic load and burden as much as you can. So, and this goes to, basically the principles in naturopathic medicine is to prevent disease and illness. Well, we have to address what's going on in our environment. So that's like changing farm policy and what foods are manufactured. So really looking at, starting with your diet is where one of the best things that I guide people to is, really looking at what you're consuming. Food is your best medicine. And if you're putting things in that are adding to the burden of toxicity in your body, well, you're kind of loading the gun. And we don't know when that goes off. So that's, one piece obviously is diet, nutrition, looking at that. It doesn't mean you have to change everything today. I mean, I started learning about my diet in 1996 when I started medical school. I'm still working on my diet, And so it is a never-ending process. And there's not a good way or bad way. I don't want to polarize the discussion on diet. It's just there's only your way. And so whatever your path is getting there, just be diligent, keep at it, and just small, steady movement towards a whole food diet, lower your pesticide risk, eating better quality meats. Now, look, I'm originally from Western Pennsylvania. The Monday after Thanksgiving is a holiday for the first day of deer season. and so those folks I grew up eating deer meat, right? Wild caught deer. And you got chronic wasting syndrome in deer, which is prionic activity in that meat. There's not a higher concentration of Creutzfeldt-Jakob disease in Western Pennsylvania.
And that is truth.
Yeah. So I don't want to promote fear or being afraid out there. So, it is. So that's a basis. And then you look at, okay, how about your water? What are you doing there? Is it, have you had it tested? Are you on well water or municipal? Definitely, I would recommend filtering your water. In the home, air purifiers. You want to create a sanctity, a safe haven, a place of peace and love in your home. So you look at, okay, are you using plastics, right? Those off gas, and there's BPA. These things have become so ubiquitous in our environment. We're just swimming in a sea of toxicity. So you just start at home, start with your family, start with yourself of looking at, okay, let me just slow, steady movement towards Wellville is what I call it. And you just start incorporating it into your lifestyle. And then, what happens is we stop buying the plastics. We stop buying the pesticide-riddled food. And then it starts to change out there because our energy, we're supporting an economy that actually helps us thrive and be more creative. But it starts at home. It starts with you. I know it feels overwhelming to say, oh, all of this has to change, just screw it. But it really does matter. So just slow, steady steps there. Looking at your water filtration in your shower, because there's chlorine in our water to kill off bugs, but that chlorine is not great for our body. So one, reduce your toxic load. Two is looking at and dealing with your shit. Like if you had traumas, seriously, like if you had traumas and you look at these ACE scores, the adverse childhood experiences, and in North America, really everybody has had trauma, like that nobody gets out alive. And it really is looking at that. Like, let's get into a creative, proactive stance here instead of a reactive, unconscious movement through life. We can really wake up to reality of what is now and just address it. The only way to get through is through. You can't go around, you can't ignore. So many people are eating to cover up emotions, or getting into drugs or substances, or binge watching Netflix to check out. And okay, sometimes we're going to do that for entertainment, sometimes we'll do it for addiction, but really we need to choose on that nutrition component of what goes in our minds, what are those thought processes in there, because we are creating what is going on out here. And if we don't wake up to that, it's going to continue to be the same. And we'll have lots of evidence to show, oh, look at this, how horrible it is. But, at the same time, if you start to wake up to the present moment of now and address those things, like get into family constellation work. That's one of my favorite ones. Or EMDR, if you've had significant traumas of abuse, they're rehabbing people out of war-torn countries with rapid eye movement therapies, and showing you don't have to go through years of therapy to uncover your wounds and discuss and really talk about it. You can actually get some eye movement desensitization, and there's Hakomi body-centered therapy. So it doesn't have to be talk it out therapy, but definitely you've got to address trauma for yourself, and then ancestrally.
I'm going to add something to that. You don't even have to have trauma to do those things. You could have a perfect childhood, and it's just going to make you better.
Yeah.
Like it's like meditation, the most important people in tech meditate, and that's because they want an advantage on the other guys. You don't have to be stressed out to meditate. In fact, if you're pretty parasympathetic and you're not sympathetic all the time, meditation is just going to make you more parasympathetic. So there's not like, same thing with like all of these therapies, everyone should have some mental health.
Totally. Just makes sense, right? It seems like a common sense, but that is, I have coaches for all kinds of aspects of my life to perform at a very high level. And that is one, we really need to, mental health still has a bit of a stigma, and it's time to really put that down, because it is so, like, I actually tell people to stop watching the news, not to be disinformed, but, it's basically a big component to put you into a sympathetic, fear-based mode, so you're not able to creatively think. And it's really fascinating to see how that works out there. And it doesn't mean don't be informed, but it also means you got to have balance and grounding, like get out in nature, put your body on the planet. Gaia is here. We're part of it. We don't live separately from the planet. And, you look at all of these, the Amazon burning and all of the different environmental components. I mean, global warming and climate disaster that is going on. It's here to wake us up. And I think we can actually figure it out, but we have to start getting into action. But that means we have to address and acknowledge that these things are going on or have happened. So that's another biggie.
You were going to talk about something ancestral, but I cut you off.
Yes, no, that's fine. So on that ancestral component, you look at your lineage and where you came from and where your ancestors are. And that's why we're here, our lineages and our lines. And you have to give thanks and appreciation and gratitude for your roots and your lineage, and acknowledge those that came before. I wake up on a daily basis. I thank my ancestors for getting us to here, but I also let them know I'm not taking the family burden further. I'm laying down the traumas. I don't want to take basically the traumas forward. I welcome the love, the abundance, the intuition, the creativity. They're really there to support us and really get into a dialogue because, as we get into more of this quantum physics realm, this figment of time is only while we're here. And so we need to acknowledge that. And we can actually future trip, we can fast trip, past trip ourselves, but, really getting into the eternal now is what we've got. But by acknowledging that and getting into relation with ancestors, I really, it is a big piece of what I went through that I want to bring forth and, really just talk about with people because it is really important. Honor your ancestors and your lineage and get into a dialogue there.
I have something in my head right now. One of my friends and me, we've been talking about this concept. Maybe she came up with it. Maybe it's something that is widely available, and I'm just haven't seen it before. But the concept of the canary in the coal mine, and how there's people with like multiple chemical sensitivities, like that person that cannot walk through the mall because they're spraying so much stuff, or that person that walks into a room and they're like, cringing because someone put on perfume. I wonder if this type of person that has an overt reaction to all these chemicals would intuitively avoid all of these chemicals and thus present with less brain disease. Have you noticed that in your practice?
Oh, that's interesting. I see those folks with more hypersensitivity on pain, right? So there is a ramped up central nervous system in that kind of overload of toxicity for them.
I wonder if because they are so sensitive, they are avoiding all of these chemicals. It's like an autoimmune disease. It's like if you have autoimmune disease, you're gonna have Hashimoto's, or you're gonna have all of these different bad things. But you're gonna be very good at fighting infections. So you might not see them for Lyme, but you're probably gonna see them because they're hypothyroid. I wonder if like this overt reaction to multiple chemicals is protective against brain degeneration, but at the same time, now they're in pain because they're so sensitive to other inputs. It's just fascinating to me.
Yeah, interesting. Yeah, I have not seen that, but I'll keep my eyes open.
Yeah, we gotta keep our eyes open for that because a lot of people with multiple chemical sensitivities super sharp.
Oh yeah, they really had done their research and really are all over it. Actually,
yeah. So that canary in the coal mine, and we should use this hyper responders as a way to justify the switch from your conventional hand soap to the glycerin soaps and your
Right.
avoidance of all of these different chemicals. Okay, moving on. What about someone that has Parkinson's? What about someone that has, Alzheimer's, MS?
Yeah, so on the workup, so I started, with nutrition and then the trauma component and then assessment. And that's where I feel like folks with these neurologic conditions are not getting a complete workup. We need to I look at, molecular mimicry with viruses. So Epstein-Barr, herpes simplex, cytomegalovirus are three of the top three that I see, low-grade infections. They don't feel ill, but they have a high burden of these viruses that are skewing their immune system. So if you go on PubMed and do molecular mimicry and whatever condition you have, you can see what other things that can express themselves in a similar fashion. So molecular mimicry, Parkinson's, it comes up with Epstein-Barr, herpes simplex virus, and cytomegalovirus. So I run titers. We check those on all of my patients with neurodegenerative disease. Heavy metal burden, right? These metals, early on, Dr. Perlmutter posted a post of a gentleman getting a glutathione push. And it was miraculous on YouTube, back in the day, 15 years ago, showed, a gentleman with the stutter step, rigidity in his walking, and did this push, and he had these really fluid strides down the hallway. And I thought, oh, great, I do IV therapy. I'm going to bring that into my practice. I was already using glutathione. I ran that on the first 5 patients that I had with Parkinson's diagnosis, and nothing happened. And I thought, did he hire a actor? Now, he did not hire an actor, but what I found and discovered was my patients, these 5 just happen to have a heavy metal burden. So you got to look at metals. And I see cadmium, arsenic, mercury, and lead are the top 4 that I see in folks with neurodegenerative conditions. That's MS, Parkinson's. I'm working them up. Dementia, Alzheimer's. We store these toxins in our fat. So, it's kind of the proverbial, you got to get the lead out. So if that's there, you got to deal.
And cadmium, usually present in someone that's been exposed to secondhand smoke or a smoker themselves. Mercury, there's many theories, from people playing with thermometers when they were kids, to consuming a lot of like dirty fish, low quality.
Well, the coal-fired plants, like here in the West Coast, we get this plume of dust from China, and they're still burning a lot of coal. Then that comes down on the West Coast here in the U.S. Central United States, we have the coal-fired plants. That acid rain goes down on New England, and then it bioaccumulates. So that's where the mercury is coming from. Also, a fascinating fun fact on the side, high fructose corn syrup, how they manufacture that, they put it through a filter of mercury. Yeah.
Another reason to stop eating.
Yeah, that is not a food. That's a toxin. So, eliminate high fructose corn syrup from your pantry and your life.
Lead, we used to have leaded gasoline and leaded paints. And then arsenic, I see a lot of arsenic. And I usually ask, do you ever live on, well water? And they're like, yeah. So that's another one that if you're drinking dirty water, I see a lot of arsenic.
Yeah, so that on assessment metals, and then I'll run some stool samples looking at the microbiome and the gut health is really also very important to take in here, and then also hormone balance. So, interesting, Parkinson's, I've heard it, some people talk about it as hypothyroidism of the brain. And there is a couple case studies on correcting thyroid for folks and their Parkinson's symptoms go away. So you definitely got to look at that. So that the assessment is a big one. And then the therapy. So on my fancy approach to Parkinson's is F is the functional medicine, which we talked about. A is this assessment that we're kind of breezing through. And then we get into N, which is nerve health. We start giving nutrients specific to nerve health. And then C is cellular regeneration. We have regenerative medicine and stem cell therapies with exosomes, and we know we can get some new neuronal growth going. Just fascinating stuff out there on intranasal delivery and on regeneration of brain. So that's why I kind of got into this brain regenerative specialist. I uncovered these gifts from my journey from Soraya, trying to turn my personal tragedy into victory for thousands.
Yeah, I love how you kept saying Soraya's gifts.
Yes.
And we honor that, and we're thankful for that, because we have the doctor of the work of Terry Walls, with MS, which was a personal experience for her.
Right.
But we really don't have a lot of stuff for Parkinson's, so it's very interesting, how you've developed this system. So where can people find you? How can people get a hold of you if they want to work with you? When does the book come out? And, how can people just learn more about what you're doing?
Yeah, so Nature Cures with an S clinic.com, naturecuresclinic.com. And if you go on there, you can download my guide on 4 signs of cognitive decline. And if by doing that, you'll get on my mailing list. I'll let you know when the book is coming out. Should be within the month or 2 here. And, I'll keep you abreast on, I have a big neurodegenerative summit coming up in April 2020 as well. So that way you can be in touch and see what we're up to. If this is of interest, please share it with anybody that that could be, help with this information. I want to get the word out. So I really appreciate you having me on your show as well.
Awesome. It was due, and maybe, in 6 months we'll wrap around, and maybe and we're gonna be like, oh, we're full of shit. We're switching the way we're treating everything, but because this stuff is just moving so fast. But maybe we can have you back on the show, and we can have an update on how everything is going and how things are unfolding. No prion pun intended.
Nice. That was awesome. Yes. Thank you. That would be great.
Awesome. I'll talk to you soon, man.
Awesome. Thank you, Guillermo.